Let's go over some oral disease case study type questions. So, this is taken from my week 2 class, my board exam prep academy, where I do 12 weeks of board exam preparation. And week 2 just happened to be the topic oral disease. So, we're talking oral pathology, microbiology, histology, a little bit, all of that fun stuff. But let's go over a few questions together and see how you do. So, the first one here, a 55-year-old male presents with a white, non scrapable plaque on the lateral border of the tongue. He is a long term smoker. Which is the most likely diagnosis? A, B, C, or D? And feel free to stop the video if you don't want to hear the answer yet, because I'm going to go over to the next slide where I'm going to talk over the answer with you with the rationales. So, first off, though, anytime you're reading these questions, and let's say you're taking the board exam, you're preparing, or you're like taking the board exam itself. What you want to do is read the question again carefully. So the key points here is the age. So a 55-year-old male, so it's a male, not a female. Although that doesn't always matter when it comes to oral pathology, but sometimes it does, where there are certain things that are more prevalent in females than there are males. So if you really didn't know what the answer was, you could go back to that and say, okay, it could be B or it could be C, but I know C is more prevalent in females, so I'm going to take an educated guess and it's going to be B, okay, just as an example. But back to the question here, it's a white, non scrapable plaque on the lateral border of the tongue. So the color is white. It's not red, it's not purple, it's not yellow, it's white. Non scrapable means you've tried to remove it and it's not coming off. There are a lot of white things that could appear inside the mouth, including even a buildup of saliva. It might look funny if you see it on the tongue, but if you try to remove it, it's going to come off right away because it's saliva. Even when we eat something, whether it be white or not, a little bit of food could have gotten stuck on the side of the tongue, but when we try to scrape it off, it comes off. It's clearly food. We're not going to worry about it. But when you see something, the side of the tongue is more prevalent for oral cancer, where if you see something on the side of the tongue, it doesn't mean it is oral cancer, but that's not normal to see something on the side of the tongue, especially if you can't scrape it off. Now, it also says he is a long term smoker. Which is the most likely diagnosis? So then we have to think, okay, what could be more prevalent in smokers? Out of all of these options, A, B, C, or D, what looks white? Some of these things are going to be brown, some are going to be red. There's kind of a wide variety here, but see how you have to pick apart A, B, C, and D, and really think about the question if you weren't sure. So I'm going to go over the answer now, but feel free to pause the video if you still need to think about it. So the answer is going to be B, leukoplakia. And when I go through this in my live classes, I'm also going to go over the rationales with you. I do have a little photo here. This is just kind of an example of what a white plaque could look like. This looks like it's a little bit on the side of the tongue, but it's more so under the tongue. And this question was specific to the side of the tongue. So just keep that in mind. But leukoplakia is the best answer because leukoplakia, in its definition, is a white plaque that cannot be scraped off. Candidiasis wouldn't be the best answer because you would be able to scrape it off, and underneath would be a red surface, which is what I have here for A for the rationales. But then when we're talking about C, lichen planus is very different. It's that white lace like patterns. So, yes, it's white, but lace like is specific to lichen planus. And in the question, it doesn't mention anything about a lace like appearance. And it's not typically a patch either, it's more like spider web looking white things all over the tongue or inside the mouth, inside the cheeks, that kind of thing. And it couldn't be D because I would say this is more of a wrinkled appearance. Corrugated here means wrinkled. So you do need to know the different meanings when you're taking the dental hygiene board exam specifically, but also the dental assisting one. Hairy leukoplakia is a more wrinkled appearance and it's typically black, brown. It could be white though, depending on what types of food that person's eating. But if they're a smoker, and the smoke per se is the most prevalent, then it would be either a black or brown because that's coming from the tobacco. So that's why D is not the best answer. So does everybody see why leukoplakia is the best and final answer? So please remember on the board exam, even if you liked two of these answers, one has to be the most correct, and that's the one you need to pick for the board exam. So that's where the live classes come in handy is I work through these problems with you, and that way, if you were really confused about a question, I'm going to go through it with you so you know exactly why that answer is the best answer. Let's go through another one here. So, a 35-year-old woman presents with painful recurrent vesicles on the attached gingiva that rupture and ulcerate. The episodes occur during periods of stress. What is the most likely condition? A, B, C, or D. And again, feel free to pause the video if you need some time to think about it. But this is where we go back to the question, what is the age? 35-year-old woman presents with painful recurrent vesicles on the attached gingiva. So you have to know where the attached gingiva is. It's just basically above the teeth or below the teeth if you're looking at the bottom arch. So these vesicles are recurrent, so they keep coming back, they rupture and they ulcerate. So there's a key oral pathology here of something that's going to rupture and ulcerate. Some oral pathology, there's not going to be ulcerations, but they're going to look like skin tags or a cyst like appearance. But in this case, it's not that, it ruptures. So it was filled with something and then it ruptures, but now it's an ulcer. So it's ulcerative. Okay, so there's one of these here. Now, and it happens during periods of stress. So that's also important to note. So, having all of that said, would it be A, B, C, or D? So the answer is going to be B, recurrent intraoral herpes. So this is just kind of a little example. It might look different. It really depends, but you can see sores on the inside of the mouth. Okay, this is the palatal area. This question isn't based per se on this picture. I just like to show you guys kind of pictures to get your mind thinking, right? So this is exactly what would appear because of stress. It's going to rupture and it's going to ulcerate. Now, A wouldn't be the best answer because it's more so a little bit everywhere. In this question, it doesn't say where it is, but it does say this is a 35-year-old. Primary herpetic gingivostomatitis isn't typically in adults, although I have seen it personally. It's mainly children. So you could have ruled that one out almost right away, and it's not C because this is primarily an aphthous ulcer is on non-keratinized, mucosa. So the areas inside the mouth where there's not a lot of keratin present. Okay, so we could think the bottom of the inside of the lip as an example, but these ones are on the attached gingiva. So it could be an ulcer because it did say something ruptured and now it is an ulcer, but B is still the best answer because of the location and it specifically says triggered by stress. C could be triggered by stress as well, but remember, we have to pick one, and B is the better answer because of the location. It's on the attached gingiva. And erythema multiforme is more so on the skin, not necessarily inside the mouth, the first area we see. And this is target lesions, those like bullseye lesions on the outside of the face. It's more widespread. It's not just localized to a certain area, it's more widespread. So, again, that's why B is the best answer. So, what do you guys think so far? These questions are designed to make you think. Let me know if you have any questions based on these questions. This is what we go through in our live classes. We have case studies, we have questions, we have answers, we have rationales, and we even have a live class starting tomorrow, which is our week 3 out of the 12 weeks of studying. So, just to kind of give you an idea, I'm going to go right to week 3 to give you an idea of kind of what that looks like here. But look, so there's more questions, more rationales that we go through together. So let me know if you need anything and go to dentalelle.com if this is something that this could help you. If you're looking for case studies questions to really prepare you for the board exam, you know I can help. I am always here. Thank you for watching. Click like if you like this video, and I'll see you guys in the next one.